McNicholas, and I'm a registered nurse who's going to show you how to do an advanced neurological assessment today. The utility of this assessment is to show if there are any abnormalities within the patient's neurological assessment. It's an easy, non-invasive way to show if multiple or one parts of the brain has been affected by any neurological issues, such as bleeding, pressure, or infection. In this case, our patient came into the emergency room complaining of a headache. Upon further workup, we noticed that she had a high blood pressure of 180 over 120 and a heart rate of 100. Then we begin the neurological assessment. After we do the neurological assessment at the bedside, which I will tell you each assessment piece as we go, which ones are normal, which ones are abnormal. Once we finish the assessment, then we will talk about the pathophysiological processes that correlate with each abnormality that we find. Okay, let's go check it out. Who's going to be working with you today? How are you?
Oh, okay.
What's going on?
I have a headache.
Okay. We're going to ask you a few questions and take your vital signs and have you do some sensory motor skill tests as well, okay?
Okay.
Let's start with vital signs. Can you tell me your name and your birthday?
My name is Heather Kern. My birth date is February 28th, 1960.
Okay.
Always left.
So abnormal blood pressure of 180 over 120. Abnormal heart rate of 100. I'm going to listen to your lungs. Deep breath. Two more. I'll take your temperature. Respiration's normal at 24. Afebrile, 97.8. Okay. Next part of the assessment is assessing for level of consciousness. Can you tell me what year it is?
2018.
Can you tell me where you are?
I'm at home. I'm in the hospital.
Okay. Can you smile and lift your eyebrows at the same time? Okay. Can you stick your tongue out? Okay. I'm gonna have you just look straight ahead. I'm gonna put a flashlight. We're going to do the Pearl exam. We're looking to see if pupils are equal, reactive, round to light and accommodation. Okay, so we found an abnormality. They are not reacting equally and they are not round bilaterally. Okay, do you have a headache?
Yes.
Can you rate your pain for me 0 to 10?
I have to say it's at least an 8 out of 10.
Okay, is it constant, throbbing?
Throbbing.
Okay, so quality of pain, throbbing, quantity of pain, 8 out of 10, another abnormalities. Do you have any numbness or tingling in the arms or the fingers?
No.
Okay. All right, so next we're going to do a muscle reflex test. I'm gonna have you stick your arms all the way out like this. I'm gonna have you wiggle your fingers. I'm gonna have you put your hands like this. Push my hands up towards the ceiling. Push my hands down towards the floor, okay? Her left side is weaker than her right side. I'm gonna have you kick your legs out towards me and pull them back in towards you. Okay, again, the left side is weaker than the right. So both in the bilateral upper extremities and bilateral lower extremities, the left side is weaker. Can you squeeze my fingers? Okay, left side again, more weak than the other. Can you touch your nose with your index finger? Okay. And, okay, one more thing. I just want to grab a soft cotton swab. I'm going to have you lay on the bed. And I just want you to close your eyes and tell me which leg I'm doing this light touch with.
My right.
Okay. I'm going to put pressure on your legs. Tell me which leg I'm putting pressure on.
My left.
Okay. Thank you. Okay. I'm gonna go tell the doctors what we found and they'll be in to see you.
Okay.
All right. Okay, so we found some abnormalities during the test. The main ones were her Pearl examination was abnormal. Her pupils were not reacting to light appropriately and her eyes were not symmetrically round, okay? Dealing with this, we could see if there's pressure in the brain, possibly on the optic nerve, which is creating a physical assessment that is abnormal with her eyes. The next abnormality that we found was the muscle strength and symmetrical test of the bilateral upper extremities and lower extremities. Both her left arm and left leg were weaker than the right side. All right, so that can show us concern for frontal lobe damage. The frontal lobe generates nerve impulses that control and execute movement in the body. So damage to this area would not allow her to use her muscles appropriately that she would want to. Again, all of the tests that we're doing during the neurological assessment are non-invasive tests that would show a need for further workup. The third abnormality that we found was her blood pressure was high at 180 over 120 and her heart rate was high at 100. When the blood pressure is that high, that can show a cause for blood clots. follow me into the bedroom, into the hospital room one more time because we have one more question to ask the patient. There are 3 additional assessments I wanted to include within this advanced neurological assessment. They were vital signs, okay, which we already did. We also wanted to include a pain assessment, which we did. She had complaints of a headache, 8 out of 10, and it was a throbbing type pain. The third additional review of systems questions that I wanted to add was medication reconciliation assessment. So let's go back into her room and ask her if she's taking any medications, strength, and frequency. I just forgot to ask you one more question.
Yes,
Are you taking any medications?
I am.
What are you taking?
I'm taking Coumadin, 7.5 milligrams a day.
Did you take it yesterday?
I did not. I ran out. My prescription ran out.
Do you know how many days you haven't taken it?
I can't remember.
Okay, I'll let the doctors know. Another abnormality. By adding the medication reconciliation assessment to our advanced neurological assessment, we found out patients taking Coumadin, 7.5 milligrams once a day, hasn't taken it for, she doesn't even know how many days. So things that the doctor's going to do, order a PT-INR test to see what dose is appropriate, but looking at the abnormalities that we found during the neurological assessment mixed with the medication reconciliation assessment and the abnormality that we found there is a good chance that she had a stroke. So further workup is indicated. I hope you enjoyed watching this video on how to perform an advanced neurological assessment, and please email me with any questions. Thank you.